Hello and welcome back to the show. Now if you've been watching, you've learned a lot because I know I have. I didn't really know about asthma. I knew a little bit about it, but not a whole lot. And I've learned a lot about COPD. I even know what it is now. So now we're going to come back and we're going to talk to Dr. Tracie about signs and symptoms of asthma. Because you never know, your child may be suffering from asthma and you don't know. So signs and symptoms, Dr. Tracie.
Yes, ma'am. Sometimes we don't know when our kids have asthma because it's some subtle things that you can look for. The one thing that everybody knows is wheezing.
Yes.
So everybody thinks about just wheezing in asthma. But sometimes with athletics or even with play, if your child is complaining about chest pain or chest tightness, feeling tight in the chest, if we have a cough with running, you shouldn't just, every time you're playing hard, cough, 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 cough. A nighttime cough, a chronic cough at night. Now, not necessarily when your kid is sick, when you have a runny nose and is sick, but if every time your kid is laying down, you're hearing a nighttime cough, a cough throughout the night, that's something to think about, is asthma. Another thing is just with movement. If you have a shortness of breath with more movement. Sometimes kids themselves keep themselves from being active because they know how they feel when they're active, and they feel short of breath. They feel tight in their chest, and those are some signs of asthma. And so if you're noticing that your child doesn't play like other kids or has a cough every time they play or can't run and keep up with other children, that may be one thing to at least talk to the doctor about.
That's good to know, because sometimes we don't think about that.
Right.
And so if the child is not sick and they've got a cough, you check them, they don't have a fever, the nose isn't running, but they have a cough, it's time to think about it.
Right. At least, especially at night. It's something about the nighttime cough.
Okay. So now, Dr. Sinha, what are some causes and symptoms of COPD? We may have talked about it, but somebody just walked in the room, so they didn't hear us.
Okay, great. So regarding the causes, we wanted to reiterate that smoking is such a big part of COPD. Secondhand smoke is something that we really should pay attention to as well. So typically what you hear is somebody can tell you, come to your office and you're diagnosing me with COPD by my symptoms and by my breathing test, but I never smoked before. And if you dig down on their secondhand smoke exposure, you can find out that there may have been a spouse that was smoking all along, or when they were a child, usually before the kindergarten age, if one or both parents smoked in the house, the child themselves can end up with COPD and later in life, despite not being an asthmatic and not being a smoker.
Wow.
Sure. So pollution in the air is not a big problem here in the Arklatex area, so that's a biggie in some countries. In India, where my family is from, people get COPD just because of the air pollution. So that's a biggie. Some of the work environments around here, if you're in a very dusty work environment, depending on what kind of manufacturing you're involved in, you have to be very careful to prevent yourself from getting exposure to the environmental dusts and things that are available at work. Chemicals and whatnot, those are also problems. So doing a very common sense environmental review is really important. It's a little off topic, but sometimes after the rains, a lot of mold can surface, and mold can cause some of the things that doctor was describing in asthma, as well as COPD-like symptoms as well. So the symptoms for COPD, besides the causes now, are similar. There's a cough, and those coughs can sometimes be productive of mucus, and other times the cough can be dry. So you'll see the same in asthma as well. Shortness of breath, chest tightness. When you walk around, sometimes you get short of breath with exertion. Those can all be symptoms of this problem. Nighttime cough you can also see in this condition. And you have to be very careful to watch out for things like nasal dripping and heartburn, which can also occur at nighttime and cause coughing that can exacerbate asthma or COPD. So it all sort of plays together, and we want to pay close attention to the environment and the things we're doing to ourselves, and then to some of these very common sense symptoms.
Wow, I'm sitting over here diagnosing myself.
Yes, ma'am.
I've already decided, okay, when was the last time I had heartburn? Oh, when was that COPD? Oh my God, what about my nose?
Yeah.
Okay,
We treat it all, trust me.
Well, I see, 'cause I'm over here diagnosing myself. So, Dr. Sinha, what about emphysema? Because that's a big word.
It is.
Yeah, what is that?
So emphysema is another variation. Remember on COPD we had the chronic bronchitis and then emphysema.
Okay.
So emphysema, chronic bronchitis is really a disease of the airways, and emphysema is a disease of the air sacs. Okay, so our airways, like pipes, they lead into the air sacs, and emphysema has now affected the air sacs themselves. So when there's some form of breakdown or destruction of the structure of those air sacs, then they functionally become impaired as well. So they don't exchange gas, carbon dioxide and oxygen as efficiently. So it's a form of COPD, mostly involving the distal air sacs.
Wow, I'm telling you, let me see, heartburn, I don't know what I'm gonna have next. I'm gonna be one of those people who are always sick, I guess. So now, Dr. Tracie, what is the difference between an inhaler and a nebulizer, which I hope I said that right? So what's the difference? Are they the only way that someone can receive quick relief? Question I got off the internet. You know, the internet is always right.
That time the internet was right.
Good.
That's rare. That's rare. Don't Google. People do not Google.
Okay.
But the nebulizer is actually the machine that gives you the treatment through the machine. You put the liquid albuterol in the machine, and it actually, with the mask, it just blows into your and you breathe it into your lungs. The inhaler is a little bit faster than the nebulizer machine because you actually have it there and you can carry it around in your purse and the backpack for the children, and you carry it around and you use the inhaler, and you're able to breathe in 2 to 4 puffs of that inhaler as you need it. Now those are for quick relief.
Okay.
So when you're having an asthma attack, or you're having what we call an exacerbation of your asthma, you just walk into a smoke-filled room and you feel that tightness and you start that cough. Or at night when you're having that cough, and you really need that relief, then that's when you can use the nebulizer or the quick inhaler. Now there's also a daily inhaler, is what we call a controller for people that have asthma, and that the quick one does not work, or they use it a lot. You shouldn't use a rescue inhaler more than twice a week unless you're using it just prior to athletics. If you're using 2 puffs just to open you up because you know you have exercise-induced asthma and you need it, then that's fine. But if you are a person that has that inhaler attached to them all the time and uses that, then you need a daily controller to keep your lungs open, a daily inhaler. And so those are a little bit different because they're long-lasting. And so you have multiple different types of daily inhalers that are used for the severity of the asthma.
That's good to know, because I'm aware of the inhalers. I'm more aware of the daily inhalers because I know someone who has to have that daily inhaler, and if they go without that, it's on, so, and so to speak. So I'm aware of those.
Right. Let me put in a little input. If your physician prescribes you a daily inhaler, it is to be used daily because some people use it when they need it because they feel, I feel bad today, and so I'll use it for a couple of days and then I'll go without, but that's not controlling the asthma. And so then they use the rescue inhalers a lot. The whole purpose is that you don't need your rescue inhaler often, and so you can't use a daily inhaler like a rescue inhaler. That's not appropriate. The whole point is not to have to use the rescue, not to have attacks, to keep kids out of the hospital, out of the ER. The ER, one of the most common things that they see are asthma exacerbations with kids. I don't know about with the adults, but it's a lot of missed school, a lot of hospitalizations because of asthma, because of not using the medications correctly, because the medicines actually can control asthma. Asthma can be controlled.
We just have to do what we're told.
Yes, ma'am.
Who wants to do that?
Right.
Who wants to do what they're told? My goodness. So now, Dr. Sinha, what devices are available for COPD treatment? So we've talked about inhalers and nebulizers. Do we use the same things?
We do. We do use the same things, and then there's other things as well. Okay. And the treatment for COPD, like for asthma, varies depending on the severity of the disease. So you can be stage 1, stage 2, stage 3, stage 4, 4 being the worst stage. So when we start patients out on treatment, these daily inhalers that we're talking about usually start in about stage 2, and they contain a long-acting albuterol that lasts about 12 hours, and they also include something called a steroid. Okay, so you're inhaling a steroid and a long-acting albuterol. And then beyond that, there's additional medications that are added when you get down to stage 2, stage 3, where you add a second inhaler that contains a third drug. And we call those, like Spiriva, for example, is the name of one of those.
Oh.
But it's a long-acting muscarinic agonist. There's new ones out from other companies like Anoro. So many of my patients are on those as well. And then when you really move into advanced stages, you're talking about patients needing oxygen therapy, and they're on oxygen continuously. And there's data supporting and not supporting the use of oxygen, but we're still using it mainstay. And beyond oxygen, there's even machines that go on the patients at night. So similar to what a patient will use in sleep apnea, we also use positive pressure air at nighttime, and folks will sleep with those things.
Wow.
Surgery is also offered for cases of certain types of emphysema, and we're waiting for the FDA to approve something called a pulmonary coil as well, where it's implanted in the lungs and it sort of stents the airways open and helps with breathing. So there's a lot of movement in the COPD field right now, and the main thing is to get to your doctor and get assessed, get your breathing test done, and then get on the right therapy as early as possible.
Wow, there's a lot of things
There are.
happening.
Yes, ma'am.
Oh wow, a coil. Oh my goodness, that they
Yeah.
can put down in your lungs.
Sure. Yeah, it's waiting for FDA approval. So at this point, it hasn't gone through the approval process, but it is used in other parts of the world commonly.
Wow,
Yeah.
that is something.
Mhm.
You all have, I mean, oh my goodness. Well, believe it or not, we're out of time. This has been awesome. I want to thank you both for being here because, I mean, you both have given us a wealth of information. So people should be running to their doctor because they know they're sick. Oh, I shouldn't say that. But they know that they're having coughs and all of that. So thank you both for being here. Thank you
It's a
very
pleasure.
much. We sincerely hope that we have not only informed you, but entertained you. And as you can tell, there are a lot of things happening right here in Texarkana. We will see you next time.